Thank you. Thank you for having me, and thank you all for coming. I'm going to talk to you about something that I think is quite important, and maybe some of you will too. Imagine not only losing your memories, imagine losing the very essence of who you are, your personality, your emotions, your sense of self. Every thought and feeling is governed by the brain. This essential 3-pound organ controls everything, from the most simple task to the most complex human experiences. And although people often associate love with the heart, that will change because it's the brain that loves. And the brain defines you, and when your brain changes, you will change. In my lab, we try to understand these changes. Despite many advances in neuroscience, we know very little still about the brain. We're starting to learn how cells communicate. We're starting to understand how they generate memories and emotions, but we have so much more to discover. We are trying to understand how healthy brains differ from those with conditions like concussion, Alzheimer's, frontotemporal dementia. I'd like to start, however, by telling you a little bit or clarifying some things about dementia. So dementia is basically a constellation of symptoms that impact your daily life so much that you become dependent for the things that you used to be able to do on your own. It isn't really a diagnosis. It's actually an umbrella term that includes many different causes. Another thing about dementia that people sometimes don't realize is it doesn't only affect your memories. It can affect your language function, change your personality, give you symptoms like depression, anxiety. And lastly, although we think of dementia as a disease of the elderly, there are many people who have dementia who are in their 40s, 50s, 60s. Many have been misdiagnosed with depression or simply aging. And that misdiagnosis can lead to lost jobs as well as failed broken homes. So in my lab, maybe I've turned it off. Yeah, in my lab, we actually use clinical data with imaging, genetics, biofluids like your blood, your cerebrospinal fluid to make diagnoses, to uncover the multiple pathologies at play that are causing all of your symptoms. The hope is actually to be able to bring you personalized treatments. I think it's important to note that, these brain diseases, these neurodegenerative diseases, they actually begin in our brains decades before we show any signs of disease, actually, when the scans look completely normal. In my lab, we try to uncover these changes at very early stages. We try to understand how these multiple pathologies can live in the brain at the same time and interact with other processes like inflammation to damage the brain and cause the symptoms that we see. I also try to understand how repetitive head injuries can cause different neurodegenerative diseases, including that chronic traumatic encephalopathy that we have described in athletes. I look for commonalities and differences across the neurodegenerative diseases to try to find proteins and pathways that we could target so that we could modify the course of the disease. And that actually brings me to our very new clinical research unit at Toronto Western Hospital and the Krembil Research Institute, where it's not about making discoveries. Actually, we want to translate those discoveries to help patients, and that is what we do. We take the discoveries from the lab, we turn them into clinical interventions with the hope that we will be able to help patients. We take real-time biological information from patients, bring it back to the lab, and then design therapies that are very personalized with the hope that we will be able to alter the course of their disease. And we're very fortunate at Krembil because we can leverage discoveries in other disciplines. So, we can learn from arthritis, brain, vision, and cancer, and create new interventions. As well, we have new ways of looking for, we can assess new therapeutics on a personalized level. People often ask me, how is it that you can work with people who have these terrible diseases? Well, they inspire me to work tirelessly towards finding a solution. We understand a lot more today, but we still have so much more to learn. We are now able to take, you've heard recently, to take people's fluids, create cells, create organoids, but as well in our everyday life as clinicians and as researchers, we can now intervene. Every breakthrough that we make brings us one step closer to ensuring that patients live long, healthy lives with their memories and personalities intact. Thank you.
Thanks so much, Carmela. This sounds very hopeful. And I'm just wondering, I mean, dementia is such a devastating disease. What are the chances that we are going to have better treatments in our lifetime?
I would say 100%. You know,
100%. I'm going to hold you to that.
100%. I work in a field where, you know, until a few years ago, we had only failures in Alzheimer's disease. We now have 2 drugs that are FDA approved to alter or modify the course of the disease in Alzheimer's. We today actually found out that it got approved in Europe, so we are waiting, holding our breath in Canada. I work with people who have rare genetic forms of dementia, and we have 8 clinical trials with gene-modifying therapies for these patients. So in my lifetime, I'm thinking 100%.
Wow. In my lifetime too, I hope.
Yes.
Okay. Thanks so much.